my mom always tell me, listen, I don't like two type of doctors in my life, the OBGYN and the dentist. Okay, and I told her, Mom, the good news is I don't have to deal with the OBGYN. You have to, but I don't. So I just have to deal with the dentist. And I always say that the dentist is afraid of the dentist. Okay, a dental environment, unfortunately, it can get associated with pain, discomfort. We are working in a sensitive area in the body, and it's a very sensitive area to a point that it can get uncomfortable for a lot of people.
Welcome to the Feria TechCast, where we'll bring you all things science, engineering, technology, and innovation. Today, we are joined by Dr. Hassan Al Maghazchi, a dentist and the founder of Smiland Dental in Florida, with a unique background that includes completing his DMD at Nova Southeastern University. With over a decade of experience, Dr. Hassan has built his practice on a philosophy that blends precision dentistry with patient comfort and confidence, offering everything from emergency care and family dentistry to advanced cosmetic solutions like veneers, implants, and smile makeovers. He's passionate about reducing dental anxiety and integrating modern technology and techniques to transform both smiles and patient experience. So, Dr. Hassan, welcome to the show.
Hi, Ezekiel. How are you? How you doing today?
I am doing fine, and I'm excited to have you. So, your journey, took you from completing your DMD in Florida and now running your own practice. So, can you give us a background of how this journey started?
Well, all it started, really starting, I really don't remember. I think I was very young at the time to remember. I was like debating, should I be a pilot, a dentist, a medical doctor, like a physician, all those things. But eventually I settled down as I aged. And by at the time I was 18 years old, I have decided like I'm going to go for dental school. Okay. And of course, I started the process of doing the undergrad and then doing the grad school for dental school here in Florida, in Fort Lauderdale, where I joined Nova Southeastern University, NSU, back in 2006, and I finished in 2010. And I've been practicing since 2010 as a general dentist, and I really enjoy it. This is kind of like my passion. It's not something. Um, it's not just a job for me, it's a passion. This is what I enjoy doing the most. And of course, through the years, I've been advancing with my experiences, and I've been able to build up better patient reports, better care, better treatment options, and technologies. So, all it started like at a very young age, and it kind of like it did mature through the time. And after 15 years now, I've been practicing dentistry. I think I'm very happy where I am today.
Amazing. So, for our audience of engineers and tech lovers, what does the tech stack in a modern dental office like yours look like? What's one piece of technology that has most changed how you work?
So through the years, when I started, as I said, dental school, we did have technology at the time. And of course, through the years, the same technology has added more details, more information into the technology, as well as now we're using other technologies that we did not use back in the days. Okay. So technology did involve all aspects of dentistry. Okay. It did not just go to one aspect of dentistry. It actually, I can tell you, technology has involved the minute that you open the door to the dental office to the minute that you leave the dental office. So, for example, back in the days, years ago, when the patient used kind of like to call our office to make an appointment, it used to be kind of like they have like a little notebook. They put the appointments on it, and then they will make the appointments for you that way. Okay, nowadays we're completely paperless in that aspect. So when the patient calls in the office, we have what we call CRM, which is basically a software that will put the patient information in the chart. So the chart went from being um, on the paper into something on the computer. It's completely electronic at this point. Um, Also, the patients back in the days, like when they used to come to our office, for example, they used to fill up the forms on papers. Now we have all those forms are made electronically. So they fill up the forms on the iPad or their phone or whatever, they sign it, they fill it up, and then it will get uploaded straight to the CRM, which is basically the software that we use to keep the patient chart and patient information. Um, Also, like when you make an appointment, for example, okay, you will get your confirmation on your phone or your email, which is basically you can respond back to those appointments by confirming, and you don't need even to pick up the phone and confirm the appointment with us. So people who, for example, are having a hard time to use their phones while they're at work, now it's very easy for them to use their phones to confirm those appointments. Also, technology has involved other aspects of dentistry. Okay, so for example, back in the days when we used, for example, to do a crown, okay, which some people they call it a cap, which is the same thing. Veneers, okay, all those things. Back in the days, we used to use what we call impression materials. It's the stuff that we use kind of like to put in a metal thing and we put it in the patient mouth. It's all messy, and then the patient has to wait for 5 6 minutes until this material get hardened in their mouth to be able to capture the details that we need from their tooth to be able to fabricate that crown or veneer. Nowadays, we don't need that at all. We have what we call a scanner. Now, a scanner is basically like a camera, a phone camera that goes inside your mouth, and it will capture all those information and it will transfer it to the computer. And that computer is connected to the iCloud. So the iCloud will send it to the lab, and the lab is going to be able to fabricate that crown for us. The big advantage of this before, when we used to use impression materials to make the molds, okay, those materials sometimes, for example, we're here in Florida, okay, and if I'm going to send the mold to a different state, for example, okay, up north, it may take a day or two for them to receive that impression material, the mold. So during that process, sometimes because of the heat, for example, here in Florida, or because it could be very cold up north, there will be some shrinkage and changes in the dimension of the material, and that will affect the fit of the crown, as well as for the lab to pour up to make a model of that. Okay, they have to put some um, material, kind of like it's a plaster. They need to put it into the mold to be able to have a hard copy of it. And when they do that, there is also a shrinkage on that side as well. So there is some dimensional changes that we cannot avoid. Yes, it is. It can be very, very minimal under ideal conditions. Okay, it can be very, very minimal. Yet there is a dimensional change whether we like it or not. With the computer, with the scanner that we have today, we don't have that issue at all. It's like you're taking a picture with your phone and you can literally maximize it, minimize it, play with the zooming, change it, angle it. It's a three-dimension kind of like it's a three-dimension picture that we can rotate and play with that picture completely. And also, it doesn't have any dimensional changes because it's an actual picture for the tooth inside your mouth. So when they fabricate that crown or veneer on your tooth, it will fit and it will sit on your tooth much, 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 much better. So we have less complications with those procedures and restorations that we do in your mouth. And not just that, okay, we also minimize the chances of the remake of the crowns and the veneers. Because don't forget, if we're going to have too much shrinkage happen, then the crown or the veneer won't fit anymore. And in those cases, we have to take another model to be able um, to do it. So technology has a big effect in dentistry today. Um, Also, X-rays. Back in the days, we used to use regular films. And those films, the exposure on those films to able to capture the X-ray was much more higher. Nowadays, we're not using films anymore. We're using sensors. Okay, so sensors is basically it's a piece that's also get connected to the computer and it will capture the x-rays. Now, with those sensors, we were able to diminish the amount of exposure by about 90%. So normally when you come to the office as a new patient, for example, we take about 18 x-rays for the full mouth to be able to capture all the teeth. So to be able to minimize that by the amount of the exposure of the x-rays, now we're able to minimize the amount of radiation by 90%. That's a huge change. It's a huge change. So you don't have to get that amount of exposure with the radiation as much as before. Patients, they coming to me, they tell me, hey, Dr. Hassan, like, oh, I'm afraid of having to take the x-rays because of the radiation. And if we want to simplify it now, for example, with those sensors that I'm talking about, which we have in our practices, it's kind of like you're sitting on the beach for half an hour. It's like you're flying an airplane for half an hour. So the amount of radiation got diminished tremendously. Um, the other things technology got involved as well in dentistry is what we call a CT scan. Now, a CT scan, the regular X-rays is kind of like it's a two-dimensional picture for a three-dimensional object. So what you see right now, for example, if you look at my face, right in my face, you just see this part of my face. But if I turn, there's actually a third dimension into it. Okay. With the regular x-rays, we're just seeing this part of my face. With the three dimension, we can see three dimensions. So basically the three dimension, the CT scan, it goes all around the head. So I can, it will give us much more details to look at the teeth, the bones, the temporomandibular joints, what we call TMJs. Okay. The airway. All right. All those details we can get with a CT scan. And of course, all of that, it's technology because everything is connected to the computers, everything is connected to the iClouds, and things are getting much, much, much more detailed.
So many people still have fear for the dentist till today. So tell us how has new technology helped you make visits more comfortable and less scary for your patients?
It's a good question. So I always have this story about my mom. My mom always tell me, listen, I don't like two type of doctors in my life, the OBGYN and the dentist. Okay, and I told her, Mom, the good news is I don't have to deal with the OBGYN. You have to, but I don't. So I just have to deal with the dentist. And I always say that the dentist is afraid of the dentist. Okay, a dental environment, it's unfortunately it can get associated with pain, discomfort. Um, all we are working in a sensitive area in the body, and it's a very sensitive area to a point that it can get uncomfortable for a lot of people. However, um, what I've been experienced through the years, okay, to answer your question, there is a root problem for what you're talking about. People normally they're afraid of the dentist or they're having anxiety to the dentist because of previous experiences. And the previous experiences, some of the patients will carry that through their life. And unfortunately, they try to avoid the dentist because of that fear or pain that they experienced before with other dentists. And of course, the problem will be they will, through the years, believe it or not, I have patients, they don't see the dentist unless they are in pain. They are refusing to the dentist unless they're in pain. And unfortunately, when you're in pain, your body's telling you, hey, I'm not comfortable, go take action. So you're going to come in as a patient to the office to see the dentist, but you're really kind of like associating the dentist with pain, and that doesn't help us in the dental setup. So there is, of course, different ways of handling this. Okay. Technology is one of them. Okay. But also the dentist himself, me as a dentist. Okay. How am I going to build up this relationship with you as a patient? All right. If I'm going to have good report for you and change that history from before of fearing the dentist, then we're 10 steps ahead of the game. Okay. Um, so if we can build up that good relationship, and if we can build up that good experience, we're going to be able to break the cycle and we can have good relationship. All right. That's that one aspect. The other aspect of it is that, all right, well, Dr. Hassan, I understand. Um, I like you as a person. I can work with you, but yet my previous experiences still having control over me. And in those cases, then we can go different directions. Okay. Direction number one is we use sedations for the patients. So basically, we get them to this twilight zone where they're like cool with the treatments. They're cool with the procedure. They're cool with whatever we're going to be doing, and I've seen like a lot of success. It's a minimal amount of sedation. Don't think like you're gonna go sleep. You don't know what's going on. All right, it's very pleasant place to be in. All right, you're fully awake. You're fully control of your emotions. You're fully control of what's going on. You can talk. You can swallow. You're just in this twilight zone. You're just relaxed. And in that way, I was able kind of like to resolve a lot of issues with my patients, to be honest with you, to a point now they're coming. They don't need the medication that I'm giving them. And I forget, that they took those medications at one point because they're very comfortable and they come regular to their appointments and they just become regular people in the office. And I really beside the dental work, I feel like very proud of myself to be able to achieve such results because I was able to help people in that aspect and kind of like battle their bad experiences, battle that trauma in them, and being able to resolve those issues. However, let's say that the patient is completely um, not even responsive to this type of treatment, then there is also psychology. Believe it or not, I have a psychologist with me, okay, that I refer to for those type of patients. So let's say the patient is like, well, okay, I have so much happening, I cannot, I'm not happy in the relaxed state, even with the sedation. I don't want to be in the dental office yet. I'm in a lot of pain. Yes, yeah, I have a lot of issues. So I need to find a solution. And as I said at the beginning, we need to go to the root of the problem, which is basically the bad experiences that you had before. Um, and psychologists sometimes will be able to help us out. Now, if we're gonna have a full understanding of that fear and anxiety that all the patients are having, now I can tell you how technology is gonna help us. Okay. So, for example, we talked about taking the X-rays. Back in the days, we used to take the X-ray. Um, the exposure was higher, which you want feel as a patient. Um, but we know, as a professionals, we know the amount of the exposure is higher. However, for me to look at that X-ray, all right, then I have to put it in a specific solutions, and it may take me 5-10 minutes to be able to develop that X-ray to be able to look at it. And sometimes we take the X-ray, and after 5-10 minutes, you know, we find out the X-ray that we took is not good enough. It did not capture what I want 100%. So in those cases, we have to retake the X-ray. So now we have to reset the clock another 5-10 minutes and wait. All right. And believe it or not, um, unfortunately, science sometimes it's not an exact science. Sometimes we have to we're dealing with a human body, and sometimes exceptions will come in, and certain things in the tooth that we need to look at it from different angulations to be able to determine what type of treatment or how the procedure is going. So if we keep adding the 5 minutes, 5 minutes, 10 minutes, 5 minutes, and you're sitting on the dental chair, that definitely will, but you will start like getting annoyed. You're start like your anxiety start going higher. If you're numb, your numbing start wearing off a little bit. So now you're experiencing some discomfort or pain. So now we're getting into this like, okay, Dr. Hassan, I'm not really enjoying this. I'm not enjoying the visit anymore. All right. So of course, sometimes we have to give you anesthetic again. So the needle, the medication, the whole 9 yards. But now, for example, all right, we don't have to to deal with those films that we have to develop. It's just basically like, like back in the movies when they used to take pictures and they'd have to put it in the developer and they have to hang it to dry. It is technically something like this. Okay, so the process is lengthy, can be lengthy. But nowadays, with the sensors, okay, when we take the x-ray, it literally get uploaded immediately to the computer. It's a matter of seconds. And if I need to have another x-ray from different angulation to see how is the procedure is going, all right, I can take another x-ray and
Hmm.
literally it's going to be there in seconds. And that's how we're going to be able to control things in a better way, of course. And the quality of the x-rays is going to get bigger and better. Before we used kind of like to have this little thing that we have to look through all the details. Now I can blow it up into as much as I want, and I can look at details. So this is an example of um, just from the X-ray aspect. All right, um, how we can minimize the pain, how we can minimize the discomfort, how we can even minimize the radiation, the exposure. That's a lot of people are, they have fear for it. Okay. So all those things, once our patients understanding what we're doing in our offices, it will make them more comfortable. It will make them more um, like not as concerned for their treatment as before. So this is
Hmm.
one of the examples that technology can help us in this matter.
Okay, that's interesting to know. So I'd like to ask, what's a common misconception people have about modern dentistry that technology has actually solved?
Some people think that the technology also like some people they may think it's also the harm is still the same what we had before. Okay. The procedures themselves, I think, is the same. All right. They cannot, and I don't blame them. I did go for school to understand this. They did go to a different type of a school. And, for example, if I'm going to be talking to an accountant, for example, all right, they did go for a school, so they understand numbers better than me. I don't understand numbers as much as them. If the same account is going to come to me, he understands his numbers, but I don't understand his numbers, and I understand my dentistry. He doesn't understand my dentistry. So some people are so kind of like they think technology it's there, but it did not have a big effect on the procedures. They don't think it had a big effect on how comfortable this is going to be, how fast this is going to be. Am I going to be dealing with the same um, type of root canal that I did 30 years ago comparing to today? All right. So when they come to me, like let's say they did a root canal 30 years ago, 40 years ago, all right, and now I have to do a root canal, it's a completely different root canal. It is the same. I mean, the results is the same, but the procedures that we go through is completely different. Okay, the materials that we're using, the technology that we're using, it's a whole different 9 yards. So it's faster, it's more precise, it's everything. So I think there's a lot of patients are still stuck. Like, I mean, I'm still going to dentist, um, and I'm gonna still experience the same amount of pain, anxiety, discomfort. All right, especially if you're coming from that aspect. Um, so I always tell my patients, hey, I understand you have that before, but it doesn't necessarily mean that you're gonna experience the same thing today. It's completely different. All right, so for example, like back in the days, if we're gonna talk like 30 years ago, for example, all right, if we're gonna do a root canal, we need to take about, and let's say 4 or 5 X-rays, all right, and then the root canals is a very delicate, detailed procedures to do, and it can be very uncomfortable for the patient. So imagine going back every X-ray I take. If I need 5 X-rays, for example, all right, and I'm gonna develop every X-ray for 5 minutes. That's 25 minutes extra that I'm putting on the root canal procedure to be able to get the same result that I want to get today. That it will, it, it's a matter of seconds. I can take 5 X-rays literally in a matter of seconds, less than 1 minute. So when that's a huge change from it's a root canal. Yeah, the timing, the comfort, the material that we're using is a whole different 9 yards. So just imagine like using Nokia back the cell phones back in how old I was I at the time? I don't want to say my age exactly, but um I was what, 15 years old maybe at the time. Uh, yeah, 15, 16 years old. And if you want to type in letter C, for example, in a text message, so you have to go on number
Yeah,
2, you go
ABC.
9, 1, 2, 3 to get the C.
Yeah.
And sometimes you go to A, all right, and you say, oh damn it, I have to go back and delete. And then so imagine this is dentistry before. And now with the technology on your phone, you literally have the letter C that you can click it once. Okay. And not just that, now you can pronounce whole sentences to the phone, and you can type in your text message. So just imagine how long we have come. All right. How much technology that we got included, all right, in our daily basis. It's the same thing for dentistry. All right.
Hmm.
So
Yeah.
um so what we had before, it doesn't mean what we have today. All right. I hope that makes sense.
Yeah, it does. Yeah. So I like to ask, running a dental practice is also running a business. So what tech tools do you rely on most for the business side of things, like scheduling or patient communications?
Both actually. you know as I mentioned at the beginning of this podcast, we're depending on both. Okay, so for scheduling, we're using computers. Okay, everything is computer based. Okay. um Filling up forms is digital, so basically you can fill up your forms even while you're from in your house, or you're at work, or anywhere that you want. All right, you can fill up those forms on your phone or on your computer. All right, and with one click, everything is gonna get uploaded to our systems here. And of course, we can avoid all the papers, all the back and forth. And sometimes, like, you wrote, for example, something on the paper. Whoever's taking the information from the papers to put it on your system, we're humans, we do make mistakes. So sometimes mistakes happen that way as well, transferring the information. But if we have everything on the forms, the margin for the mistake is almost nothing. Whatever you put in there, we get it the same way. We upload it the same way. Um, Also, as I said previously, so let's say you're going to make an appointment in my office. All right, so you will get reminders. We all have busy life, family, kids, school, work, spouse, stuff like that. We get distracted with a lot of things, and life has been very fast, very quick, and very loaded. Even with all the stuff that we have in our life that we think is it's making things easier for us, yet we're still very busy with those things. So in my practice is what we do. We will send you out reminders. Okay, we will send you like a reminder 2 weeks ahead so you can get prepared. So if you have another event, along with your appointment, you can make the right arrangement um, to catch up with your event as well as with your appointment with your dental health. So you can have that balance. So we send, for example, 2 weeks before, we send 2 days before to remind you, just to make sure that you don't forget about your appointment. And we even text you 2 hours before. All right, like today, for example, um, I got notified. I have an appointment with you at 3 o'clock. All right, I was busy with all what I'm doing, patients, everything, um, and in my head, I thought it's 4 o'clock, although I'm the one who made the appointment with you, yet because I've been busy since I've been awake since 6 o'clock in the morning today. I've been ongoing, and now it's 4 o'clock. All right. Um, if I did not get notification from you saying, "Hey, you have an appointment at 3 o'clock today with Ezekiel," I would think it's 4 o'clock. So technology it did help me to understand and to get ready for you. All right, it did remind me. So we do
Yeah.
the same thing now in our practices as well. We're keeping you in the loop. Okay, we're keeping
Mm.
you in the loop. We keep updating you that, hey, you have things that are coming up. Hey, don't forget. Um, of course, some patients they say, I will put it on my reminder. I don't have to get reminded by text messages or emails or anything of that. We can sub this type of service to you, and you can depend on reminders.
Oh, interesting. So, looking at the future, Dr. Hassan, what is one emerging technology you are excited about that could change dentistry in the next 5 to 10 years?
I would love to give you an answer for this question. Um, I'm afraid I don't have an answer for you. Um, it's not one piece that it needs to play on its own to be able to get what we're looking for. Um, Dentistry is multiple things happening at the same time to get the best result. And um, if we really want to depend on one exact thing, I'm afraid that we're going to set ourselves as a profession for failure. All right. That's what I think. All right. I think everything needs to play its own role to get the best outcome. Um, of course, one of the biggest changes that happen is computer. Everything, and it's not just for dentistry; it's for everyone. All right, it's for the whole world. All right, um, with everything happening, I think the biggest thing is computer, and it's keep evolving. It's every time like we think like we hit the best in technology, we get surprised there is something else is coming up and we get surprised with that one. And once we get surprised with that one, we say, "Oh wow, like what's next?" And then suddenly we find out ourselves like the ceiling is keep going higher and higher and higher. And this is a big advantage for us, and we need to take advantage of it. Um, all what I can tell you is that I need, as a doctor, I need to be updated with this technology. I need to catch up with this. That's my goal. All right, as long as it benefit me as a practitioner and it will benefit my patients at the same time. Whatever will improve the quality of care, whatever will make the treatment easier, whatever will make the patient more comfortable, whatever is going to make it easier on everyone, then I'm behind that technology and I will adapt that technology. So, am I using the same technology from 10 years ago? Absolutely not. I'm not. All right. And I would lie to you if I would say, yes, I'm using the same technology. If I'm using the same technology from 10 years ago, then I'm outdated. Okay. So um, we're doing constant updates, constant. It's kind of like it's non-stop. All right. To our machines, to our technology, to everything. All right. So the answer to your question, what's what's the most thing that I would be excited about 5, 10 years from today? I don't know. I would love to give you an answer. I would love to have um something that um make everything is easier. Maybe one of the things actually is not related to technology is the way that we give needles. Okay, if there's a solution for needles, okay, I always say whoever's gonna invent something that doesn't have needles, they're going to be in a very very good shape. And needles, it's very it's a hard subject, whatever, however you want to put it. But yeah, I think we just need to keep up with technology at this point.
Yeah, yeah. Actually, I have a secret to share with you, Dr. Hassan. I'm scared of needles too. So,
Me too.
yeah, I hope somebody invents something better for all of us, and I look forward to that technology in the nearest future. So, your
Hopefully.
work, is at the intersection of healthcare, art, and technology. So, in that context, I'd like to ask you a personal question. What does the word innovation truly mean to you?
Innovation in my own world, I think innovation is anything can make me a better practitioner and can get me better results. Um, that's the bottom line for me. I'm a big believer. If I'm gonna do something, I want to do it once, and I want to be done with it. I don't want to do something and I keep repairing or keep redoing what I'm doing. All right, because that's not what I'm looking for. I'm looking for something. It's precise. It's good results. There is consistency in it. So that's innovation for me. The innovation is that I really want to make sure that I have what I need to be able to get what I want once. And I know sometimes things may not work from the first time, and there is nothing perfect in life. All right. I know sometimes, um, you know, um, things doesn't head the way that we want it. Okay. Um, there is a risk in everything. There is a risk in every procedure. There is a risk in every surgery that we do. Not having a risk is a lie. It's a pure lie. All right. I always tell my patients, if you have someone telling you, I'm going to place the implant for you, for example, with all the technology that we have, all right, and they will tell you, I have 100% success, then I tell those patients, you are 100% sure you need to run away from that doctor. And the reason is, all right, I'm not trying to put that doctor down, but what I'm trying to say here is that this is not real information. All right. Um, Based on the evidence-based dentistry, the success rate of the implant, for example, is 98%. So there is 2% that we can fail with. All right. So there is no such a thing. However, innovation for me is a combination of technology, it's experience, it's care. Um, it's a combination of multiple things to get to that point that we're talking about.
Oh, wow, that's an interesting one there. So, finally, Dr. Hassan, for our listeners who want to learn more about your approach to dentistry or perhaps even become patients, so where's the best place for them to find you and Smiland Dental online?
All right. So I have two practices. I have one practice in Fort Lauderdale, Florida. Not too far from the beach. So I really enjoyed this location. It's my newer location actually. I opened it about a year ago. And I have my first location is the older one. I opened it back in 2015. It's in Pembroke Pines, of Florida. They are like about, I would say maybe like 12 or 13 miles apart. I'm working in both locations. You can reach me, of course, on the phone. The phone number to the office is 954-589-0292. And also, you can reach us on Instagram. It's Smiland underscore dental. Um, that's for the Instagram. Of course, the best way to reach us is through the phone or to fill up a form also on our website. If you want to do that, you can book your appointment as well online. So these are the ways that you can reach us to the office and stay in touch with us.
Wonderful, wonderful. I'll also be sure to add these information at the show notes of this podcast. So, Dr. Hassan, it's been a really insightful conversation with you, and I am totally excited to have you on the show today.